It's Dr. Brian Cahan at the Cahan Center again, and we're talking about the new and improved Stick-It-2-Me spine model. We made this model more realistic to a human skeleton, so you have the lordotic curve for those people who want to look at the lordotic curve. But as you can see, on the outside you can't see through it. You got to use fluoroscopy to see what you're looking at, as we can see underneath here. So this is what we're looking at fluoroscopically underneath our spine model. It looks exactly like the human skeleton, as if you're practicing on a cadaver, but you don't have to worry about any biohazardous waste because this is all biodegradable. And it works just like performing procedures on a cadaver. So what we're going to do is we're just going to show you a little bit of how to do a transforaminal epidural injection and show you how the needle will respond while utilizing Stick-It-To-Me. So underneath fluoroscopic guidance, we have our spinous processes midline. We have our vertebral body end plates parallel. We are then going to oblique it so that the eye of the Scotty dog is underneath, is the supraarticular process and the eye of the Scotty dog are lined up. We then are going to sit there and mark our spot underneath the eye of the Scotty dog and insert our needle. As we insert our needle, we're going to sit there and try to follow the trajectory of the fluoroscopic beam. We're going to move our pedal back a little bit, and as you can see, we're pretty much in a good position where we want to be for our transforaminal. I'm then going to do exactly what I do in a human, and I'm going to sit there and make sure that the hub is over the needle tip. I want to start off with the hub over the needle tip, as you can see here, because then I can just slowly work the curve of the needle and follow the rule of the bevel. Right now we can see the curve is pointing out to the left of our screen, so the needle's going to go to the left. Okay, it's a little bit too far, but I'm just putting out how the needle will curve to the left. So we're going to come back a little bit, get back to our starting position, and we're going to go down a little bit. Needle goes to the left. I rotate the needle so that the bevel is now pointing to the left. The needle's going to curve to the right. Okay, the needle's going to keep going to the right as I keep my bevel out that way, and you can see the little tip of the needle underneath here curving to the right. We're then going to make it so that the needle tip goes upward by making it so that the bevel is pointing downward. And there our needle tip goes up. We're now going to go 180 degrees and advance it even further. We're going to keep doing this until we get down to bone. If you follow this trajectory, you're not going to hit the nerve root unless it's displaced superiorly. You'll know that because your patient will feel an electric shock if you do contact the nerve. It's okay to touch the nerve. We don't like touching the nerve, but if you touch the nerve, you're not going to cause any damage. If you jab the nerve, you're going to cause some damage. So as we advance there, we're now going to check our depth by going into a AP view. Okay, and we can see that we're just at the 7 o'clock position underneath the pedicle. I'm going to rotate my needle 180 degrees so that the curve is up, and I'm going to advance it just a little bit until I get to the 6 o'clock position. And right now I'm at the 6 o'clock position, and that would be a successful transforaminal injection. This way we can practice with our biodegradable model, Stick-It-To-Me, over and over again. We can just put this back in the refrigerator at the end of the day and everything's fine.